well, what does it actually yield? Does it actually help? It's not the idea to generate methods, to use methods for the sake of using participatory methods, but what does it add? How does it help you? So the section includes research from India, Vietnam, the Netherlands, Burkina Faso, and Colombia. And today we have 3 researchers who are going to be talking about their research. Around 10 minutes. This is short, and it gives you, as the audience, more time to ask detailed questions that you would like to ask. Maybe we start with the first presenter, To An Huang from Vietnam, and she will talk about how she has combined methods on her work on MSM and violence in Vietnam. To An, for you.
Okay. Thank you, Pauline, for the introduction. So I would like to introduce how I use mixing participatory and formal methods in studying violence toward men to with men in Vietnam. So this is research that I did like a while ago, but then we able to present it in the book chapter on participatory method.
Sorry,
yes, yes.
But can you make your screen bigger? Because on my screen it's so small.
I see. Okay, good.
With your mouse on the right, down, bottom, you can click
yes.
next to the size. No, down, a little bit. And now you're almost there.
Okay.
Yeah, you're almost there. Well, you could do the easy one next to that button. Next to, with the box. You see the big box?
Yeah. So I mean but because now it's let me see. Because it's
yeah, and then the box next to that.
Now I just couldn't see the no, because the okay, I think I just go to the next slide. Okay. Can you see?
Yeah.
And if you're using a Windows machine, you could just press F5.
Yeah.
Okay. F5. No, it's not that.
Okay, one last thing. You know where you were pulling that little, where you were
better?
pulling.
Yeah.
Yes, thank you.
Great. All right.
Is it better? Okay. Yes. Okay. So this research is about to understand violence toward MSM and then provide recommendation for policy and intervention programs. And I have some specific research questions like how does violence toward MSM occur and what are their consequences? And how does violence survivor respond to the violence, and also how can the violence survivor can be empowered to overcome all the trauma that caused by violence, but also can become the agent for change. So with that question in mind, so we think that this kind of research will require data we need the rigorous research data, but also we need some information that can help for public education, but also somehow the research can help empower the participant. And for this, we decide to use the mix of formal methods that including a traditional qualitative methods such as in-depth interviews and group discussion, but also use varieties of participatory methods like learning and training workshops, and we do a lot of co-writing with participants and to work together to produce a book, and also to do painting as a way to understand a different layer of the violence. And then there's also activity that participants can engage with the public and also present their work in the exhibition. So in the next slide, I will go in more in depth in some of the participatory methods that I use in the research. So normally, like when you do research, we only like often just ask people about their experience. But in this one, we decide to conduct a kind of like a training workshop with the participant about gender, about sexuality, about violence as a way for them to learn about the issue, but also while in the research, in the workshop, we also learn how they understand the concepts. Yeah. And with the based on the information or based on the narrative that we got from the in-depth interview, we work together on writing sessions. So the participant well, we decide like which part of their narrative they will use to write up as the stories, because they have a long, story, but we cannot put like all in the book. So they decide to pick up which part of their story to work in the book, and they, so we really like work together on that. And then they also when we have the draft, they also use the draft the draft manuscript to ask for comment of the the potential readers, and some of the potential readers also their former perpetrators. So they want to know what people think about the book, and then also based on that input, we meet together again and they discuss and decide how to select the stories to be included in the book, in the final books. And another thing, when we look together, we also see that somehow it's very difficult to talk about the pain, about the suffering, about the violence. So then so writing is also a way for us to get out like what is the meaning, what does it really mean as a violence. And then we also decide to use another method, is a painting, to work with the participant to really like narrating the violence, but using artwork. So they use their own body as, on the canvas. We not draw on their body, but they put their body on the white paper as a kind of outlining first, and they draw on that. So at the end, we got all the painting with the actual size of each participant as a way of representing them on the photo, on the painting. And then all these work also presented in the exhibitions, and the participant also work in this exhibition, presenting the exhibition somehow as just like speakers, but also as like a tour guide in the exhibition, but without telling that they are the person in the picture, because that's how we ensure the confidentiality, the privacy of the participant. Yeah. So this is such one quote that I got from the participant when they saw, like at the end, how he saw this change his thing, like he saw that after going through all these the project activities, within how it can help him to get the freedom in mind. Yeah, so like he said, I was free. Yeah. So in short, because time is short, so I cannot elaborate more, but then we can say that using multiple participatory tools like a storytelling, writing, painting, something like that, is really helpful, because researching thing like a violence as like a suffering is not easy. There's a lot of things that is hidden inside, and the research participants somehow they also have to isolate all this pain inside as a way to protect them from the long-term trauma, to get them like continue with their life. So all these multiple tools really help us to reach to the different layers of the suffering, and also not only for us, but also for the participant to release this pain in a way that also safe for them, so they can somehow healing from from this process. So because healing is also important as a part of that empowerment of the participant. Yeah. So can you like we visualize the unspoken pain, unspoken suffering, but also some of you also can really help to contribute to the change at the individual levels, but also can be at the more like at the public level. But also the combination with formal methods seem very valuable, like the use of in-depth interview or focus group discussion, because with all these already established method, you can really help to get to the very depth of the narrative. And then we also really get the credibility for the research, that so the data can really use for the academic relevance, and also validate the data, and then also have a lot of contribution to the advocacy impact, because when we bring all this to the policymakers, they also need to see that this data is reliable, right? So it's a very, very important. But and also another thing is that is how we acknowledge the different kind of knowledge, right, and evidence compared together. Yeah. And then from the process, I also draw to myself, but also I can share with would like to share with you some of the do's and don'ts that I found that is important in the process. First, it's when you say it's a participatory, it should be like a truly participatory, not manipulated participatory. So it means that through the process, it's always open, like how do you put, like a very like equal relationship between the researcher and participant, and the participant have their full power to decide what we discuss and to make decision in the process, and for where if they can withdraw, or which information should be used, or which should be presented, something like that. And the second thing that I also found very important is the safe space. And I learned many interesting things when talking about safe space, because normally when you talk about safe space, it's more thing about like a closed space that where people can feel safe. But then very, I think accidentally, the last activity of this research, because of that's based on the recommendation of the participant, we brought all of them to a new place, like to different provinces. Because in this research, the participant came from Hanoi and Ho Chi Minh City. That's the two big cities in Vietnam, one from the north and one from the south. But for the last one, so last activity, we also think it's kind of like a celebration for the research. So we bring all of them to a new place in Nha Trang. That's beautiful, where they have a very beautiful beach. And there I can see how all the participants transform themselves in that new space, and they just like went wide, they went out on street and things like that. So I think safe space is really important, and safe space also as like a non-space, like a space where they can feel free. It's very important, and also we should be authentic as a researcher. We can because through this process also many times we can feel vulnerable, we can feel like difficult to be trust to people. So I think it's very important to share that. And the fourth thing is a chain of knowledge, like I see, for example, the first activity when we work together as a training workshop. So like we do the research, we ask information from people, but we also bring some new information so people can really see the real benefits when they participate in this research. And this also kind of like a first step to create trust between us. I think it's important. And the last one, but very important, that I found that is very important, something like this, is that we should have a research partner, like a co-researcher, to work together. Because one is that because to experiment this kind of new tool, new participatory tool, right? So like you can follow something already written, in the book, but something that you also depend very much on your creativity. So have a research partner to discuss every day, to share the concern, but also to get reflection, to get a different view. I think it's very important, and especially for research on violence, because for every day you listen to the suffer of people, to have someone to that you can share that distress. I think it's important, and that can also help you to survive also through the research as a kind of like a violence listener. Yeah. So that's the thing that I would like to share with today. So thank you very much for listening. Yeah, and I'm looking for questions. Yes.
Okay, thank you so much, Tuan. Time flies. So maybe there are some questions. There are some questions in the chat. So maybe we can first listen to the colleagues
I cannot hear you.
Can you hear me?
We are able to, Pauline.
Okay. Okay. Oops, I don't know what to say. But maybe I'll put it in a box. So maybe our colleagues from India, Sonia and Anusha from an organization called Praxis, can present first, and then we'll have a look at the questions in the chat, and maybe there are some questions that we can combine in the end. But in that way, you know, we'll have 2 full presentations and hopefully enough time to have a little bit of interaction. I know it's Friday, so it's late for many people. Thank you for coming. And yeah, I'd like to give the floor to Praxis.
Thank you so much, Pauline, and thank you, Tuong. It was very interesting to hear about the research that you, the methods that you have used. So I'll just talk to you, I'll just start with this conversation, continue this conversation about the experiences of Praxis in a context of trying to understand the prevalence of the causes, consequences, and the prevalence of forced labor among adults and children in different parts of India, like primarily in states of Tamil Nadu, which is in the southern part of India, and Bihar and Uttar Pradesh, which are states in the northern part of India. When we started out with this exercise, we were looking for, there was a need to have a range of innovative measurement processes to understand what the impact of a lot of interventions that were happening on the field with these groups were. So the point where we started was basically that when you talk about the concept of forced labor, there are a range of definitions and understandings around it, and it is difficult to just say that only this is what forced labor is. The second thing was that no single method could actually unpack the nuances as well as generate scientific data. Then lived experience is also a very varied kind of experience, and it spans a wide range, and it needs to be captured to be fully to have some full understanding of what forced labor actually means to the people who are in the situation. And the last one is one of the basic crux of participatory research, which looks at the need to give feedback to the affected communities so that they could validate the results and also use the results of the research that we are using for any kind of action that they would want to do themselves. So these were basically the starting point for the research that we did. Just to take you through to what the various different kinds of research methodology that we used. So initially we started off with interviews that we did with frontline organizations, with organizations working on the issue of forced labor in these communities, with people from these communities who are vulnerable to forced labor. Then we went on to collecting around more than 350 case stories, life stories of those people who are experiencing different types of forced labor, and analyzing these life stories, and through it determining what are the questions that could be part of our participatory statistics tool that we were developing, as well as what could be the certain themes that the organizations, the frontline organizations and the communities in these areas could do participatory action research in. Then the second part of it, drawing from this, was designing the tools based on the life story analysis, designing a tool that could be used by the communities. So it was essential that the tool had to be a pictorial tool, because we were working with communities that were to a large extent not literate. And for them to have ownership of the data, ownership of the research, it was important that this tool would be something that they could understand and work with. And based on this, the baseline and the endline data was collected 3 years apart. So the data that emerged from these processes helped basically on one level with project interventions that were taking place. And the second was to facilitate the action research in different community groups across North and South India. So going into a little bit more detail into some of this, like the life story collection and analysis that took place, brought together organizations which had collected these life stories, brought these stories together, and through a 3-day workshop, they actually went through different aspects of these stories and created a systems map to understand what are the various causal relations between forced labor and what are the various dynamics that influence them. So yes, so while this looks a little bit like overwhelming, I think as the people who were part of the generating the system map, it was something that evolved through this 3-day workshop, and it also helped in generating a lot of insights to design the action research as well as the participatory prevalence tools that we did. The action research meetings themselves looked at a range of topics and themes. For example, it looked at how children from a particular community, like the Dalit community, how they were losing out on education and how they could be linked back to the education. It was looking at aspects of health and indebtedness, which are some of the biggest learnings that came out of the life stories and the interviews that we had done. And also there were groups. So these community groups took up these themes, and over a period of 1.5 years, they looked at what some of the actions they could take up within their groups. And they also reviewed these actions periodically by meeting every month or 2 months, and to see what new learnings they could bring, what were the new lessons they could learn from their experiences, and how they could inform the experience with some of the evidence that they generated through using participatory tools, some of which are visible on the screen. As far as the prevalence and the prevalence tool that we spoke about, the participatory statistics, was like the pictorial tool that was developed. The first step of this exercise was a community mapping that was done by the frontline organizations in the communities that were selected for this engagement, mainly to identify who were the respondents who could be a part of this, like randomly identify respondents who could be part of this process, and also to understand what are some of the services that are available to these communities in terms of health, education, etc. And each respondent then shared data for 3 households, 1 their own and 2 immediate neighbors. So depending upon the size of the hamlet, there were about 10 to 15 respondents for each hamlet. So we had data for about 45 households per hamlet. Totally, there was around 3,489 across 83 hamlets in North India. And in South, it was around 2,970 hamlets, 2,970 households across 66 hamlets. So this was largely the process that we undertook. That's a sample of the pictorial tools that we used. The idea was that these tools were facilitated in a group of these 10 to 15 people. Because most of it was pictorial and it just required indicating which was the applicable responses. Eventually, like you also had the literate respondents supporting the non-literate respondents. So it was a collective process. And after this, soon after this, like in the same meeting, what would happen was the extent of prevalence of forced labor was calculated. And this was discussed with the groups to understand whether this actually, the numbers that emerged through this tool was reflecting the reality of their hamlet, and to also understand certain other aspects related to it. Around like how forced labor can be seen in their communities. So this is largely what the method that we followed was. And Soumya will take us through what worked and did not.
Thanks, Anusha. So I think just to reiterate, like Anusha said, we ended up using a lot of participatory methods, which included visual mapping, so mapping using spatial locations, trying to understand time dimensions, trying to understand different kinds of relationships. So those were the kind of, purely participatory methods that we used. But a lot of these were again supplemented by individual interviews. A lot of these principles were extended to generate numbers at scale, so participatory statistics and so on. So I think, overall, there's been a very large number of learnings for us. And we just thought that for practitioners here in the audience, it might just help to understand what worked really well and how you can actually adapt these to some contexts, and what are some of the things that need to be kept in mind. So I think essentially for us, the bottom line principle was that this needed to be entirely a bottom-up process. So, community participants were engaged in all of the kind of key decision-making processes about the trajectory that the research should take, the design, a lot of the analytical components as well, even helping us to figure out, what specific symbols or artwork need to go into the tool itself, which could be easily comprehended by people in living in the North as well as in the South separately. We also understood that this definitely needed to be beyond just, a large enumeration exercise. And it was much more about a kind of, a collective analysis and action process. So the approach ended up using this, large combination of tools that we just spoke to you about. And these were chosen to help people who were actually living in situations of forced labor, to get a say in how they should be counted. Because I think what we also need to remember here is a lot of the people who were in situations of forced labor themselves didn't necessarily acknowledge or know that they were forced laborers. So it was largely about, how they interpreted how they should be counted. They should be able to input into the results. The process for us was far, far more important, or maybe as important as the outcomes themselves, because the idea was about being able to generate a critical consciousness and awareness among the sets of respondents and communities that were having that lived experience. I think one of the other, this also allowed us a tremendous amount of flexibility for process-related innovations, many of which happened, from the first process onwards over the kind of 3.5-year lifespan of the entire engagement. And I think one of the big pluses is that mixed methods actually tend to also be preferred by a lot of the donors, because they do want to look at this investment that they are making much more critically, to understand the extent of the problem, to look at what its determinants were, which it did in this case as well. And this sense of empowerment and agency would actually kind of, help them to make demands, to seek or modify services for different sets of stakeholders. And it also holds a lot of the service providers and organizations to account, and to kind of be accountable. And I think like any good research process, this did have its fair share of challenges. And I think what we just wanted to share here is that the emphasis for us all along had been to, ensure that we're borrowing very heavily from, concepts of Freirean thinking on emancipation and the need for, being able to create space for people who are experiencing marginalization to come together, to be able to find their voice as well as to build confidence. And this was also kind of complemented by the idea of, action-oriented social justice, where research participants kind of co-create knowledge and also take decisions about action, and they open up spaces for influencing. So the challenges here were plenty. There is a very gendered perception of, what capacities women possess. And in the context of statistics and anything to do with numbers, it was just assumed that they would not be able to contribute. And a lot of this was also something that the women felt themselves. So it took a lot of coaxing to ensure that there were as many women, if not more, as men who did participate in all of these exercises. I think different levels of literacy also impact any process quite differently, because the better, and like Anusha said, a lot of the people who ended up being more literate did collaboratively support this process itself and help those who couldn't necessarily work as quickly or efficiently as some of them. I think the success of any process really depends on the investment of time, money, and to a large extent on the capacity building of the facilitators. So that is something which, so this last bit is something which would which would probably, either catapult your work into the direction you hoped, or could also have very serious repercussions on it. So that is something we need to watch out for. And I think the last is that, the research ethics and the community's approval is often something that is quite overlooked. And in contexts like this, I think it's really important to not just have institutional review boards sign off on any work that we do, but to ensure that we have a community-led ethical review process of the entire study, so that we can ensure that it's not just our idea of the community's ethics that actually dictate what happens in this study. I think very quickly, we just wanted to end with just two thoughts. So in any way, attempting to build any kind of inclusive process in the context of marginalization, as we know, is not simple, it is not linear, and is not predictable. And using these kinds of mixed methods definitely help to evolve a lot of processes over time. And I think needing to have a very deep understanding of local contexts definitely facilitates the use of research to mitigate a lot of tensions. If any of these methods become context agnostic and are replicated without any, localized modification, there's definitely a danger of, exacerbating an already tense situation. So it's very important that processes should help groups to kind of pursue their own agenda and not just satisfy, what the researcher's curiosity is. Thanks.
Thanks. Thank you so much, both three presenters. There are a lot of questions in the chat box, and I've kind of gone over a few. One of the questions that seems to be applying to both pieces of research is this is issues of measurability. And integrating different types of analysis, academic as well as more artist-led. So and this related to the issue of healing. So maybe to Ang spoke about healing, and Sonia and Anusha, you didn't use that word, but it would be quite useful perhaps to talk about the prevalence changes that we saw, which perhaps is a form of healing or maybe not. Who would like to talk first about healing and what it means and measurability? Because that's, interesting, I think.
Okay. So thank you for the question. When they're talking about healing, there's a therapy. It's called NET, narrative exposure therapy. So the main thing of that therapy that you help the participant to expose to their narrative and what they call as a hot narrative and hot memory and the cold memory. So normally things happen in the people who suffer from violence that there's a disruption between the experience of the violence. So they only remember the painful thing that happened for violence, but they cannot connect it with things happened before the violence and also after the violence. So in the research, when we do the narrative through text, for example, helping people to write it down, and also with the painting, somehow the process, we help the pupil to go step by step to expose to their own memory, but without threatening them. So that is to really help them to comprehend their own experience of violence. So that's really help with the theory, with the suffering. So they not hide away from the violence, but they confront it, but in a safety way. And especially in this research where the participants can work together, so they themselves create a network of peer supporting, and peer caring. So that's also help with the healing. So in this research, most of the participants really keep their friendship together, beyond the research, and they support each other in their life after that. And so, yeah.
Great, very clear. And as you mentioned, it's a process that, and also I think the colleagues from Praxis mentioned that you need to leave room for flexibility, for innovation, and what is also very important is facilitation. To create these types of spaces where people can express and dare to express. It's not just you that can be scary as a research, but people's own minds, people's own memory of something. Anusha or Sonia, can you talk a little bit about, any kind of healing or empowerment and how you knew that was happening?
Sure. So just to give you a kind of an example from one of our experiences with the action research process, like when Soumya was talking about the challenges, she did mention about the various the challenges of one issue being non-literate communities not being comfortable, and the second was related to the patriarchal issue of how women are not necessarily connected to numbers, especially in communities that we were working in, which were vulnerable to forced labor. So just one example that automatically comes to mind is when we started off with the action research process in around 2016, there was a lot of hesitation. There was a lot of hesitation even to participate. But over time, one of the big changes that we saw was, like, for example, a woman who, an old lady who was even hesitant to talk about anything, or she would sit in the meetings. She would attend meetings, but she would sit at the end of the circle during the meetings. But eventually, like towards the end, when she understood what was happening, and like we actually just told her to indicate houses where there were like children who were having difficulty in continuing with education, and like we just asked her to mark it on the map that the group was creating. And she was like, oh, that's all you want me to do? So that's so simple. Why didn't you tell me this before? Like, you know, she had all the knowledge, she had the inclination to participate. And and it's not always an environment that allows you to participate or asks you what you can like how you can be involved in this process. So I think through the action research process, as she was involved in these meetings over time, she also figured that yes, this was something that she could do and she could be part of. And that, I think, was definitely one kind of empowerment. And also the small actions that people, community groups, the participatory action research groups were able to, small changes that they were able to bring about in their communities, went a long way in boosting their confidence. And in some communities, like in South India, you also had communities that said that we are going to take steps so that we do not have like brokers or traffickers to enter our hamlet. So like from very small steps to bigger steps, these are things that I think sometimes get missed out. And these are things that definitely indicate empowerment and change in, and it's also a kind of healing in a way.
Great, thanks. There is a there's lots of questions, but the last question about in the chat, which is something that I think might interest quite a few people, is when funders commission you know, impact assessment or hard data and, you know, RCT, you know, how are they interested in participatory methods? What would you say to them? Maybe that's because I think we've all had these experiences, and maybe you can share a little bit about how you can talk to funders, what the benefits are, and then again link it to mixed methods. Anyone who wants to go first?
Okay, so maybe we can start. Since we're an organization that's worked using participatory methods for over 25 years, exclusively, we found that a lot of funders are actually quite amenable to use these as the primary methods of engagement. And I think one of the main reasons is because they are able to see results. They're able to satisfy to a large extent the scientific community with a lot of statistical information, because there are very proven methods of actually generating statistics in a participatory way that can be quite easily triangulated. So they do find these, you know, quite satisfactory. And the kind of level of detail and rigor that one can go into, and the kind of qualitative changes and nuances that can actually be quantified in very interesting and beautiful ways, is something that donors are now very happy to kind of express, you know. So any qualitative change that also comes about in the community that is typically quite a challenge for most of the male practitioners, is something that can very easily, with the support of community members, be converted into a quantifiable measurement process. So we do find that funders do, I mean, there was a big lull in, you know, participatory methods after a lot of the funders in the 90s kind of stopped putting it on their, you know, checkbox of what are the things that you have to do to ensure that this is a good, evaluation or monitoring process. But I think more and more increasingly now, because the mechanism of participatory methods has also changed quite drastically. It's not just about doing mapping tools or collecting information in a participatory way. It's about ensuring that you can facilitate ground level panels. You can get people with lived experiences of marginalization talking to policymakers, sitting across the table from them. You could use a range of different information communication technology mechanisms to tell, like Tuan showed us, a beautiful and very powerful digital stories and narratives. So I think because this range is expansive as well, there's definitely a lot more comfort in accepting these as the primary mechanisms of ongoing measurement.
Thanks. Yeah, just to add to what you're saying, I think in this bonded labor research, it was really mixed in the sense that the donor also wanted to have enough statistical power, to have enough coverage, and that combined, having that combined with these participatory approaches and explaining to them how a participatory approach was more ethical and probably would give more relevant results. That combination is, for some donors, really something that they're looking at, just because they want to know, for example, if they have an intervention, what is the difference from the beginning to the end, and they like to see numbers. Not all, sometimes the richness of the data is enough, but as soon as it's about prevalence, often a mixed approach, as we've all done there, helps. Maybe Tuan, you can talk a little bit as well, because you've also, I believe, worked with different donors on this research. So how did this combination of methods help or not help? Maybe it wasn't useful for the donor. Oh, are you back? You're muted, Tuan. You're muted, Tuan. You're muted.
Okay.
Sorry.
Okay. Yes. So I would like to add on that Sonia just said is about the value of the participatory method to the other, like a more quantitative. So I'm not really to try to quantify the qualitative, but I think it's more really to see how people to get that nuance of using this participatory method to understand the hard number. So for example, like in the because then people who often do hard number, they also recognize that it's not easy for many people, including policymakers or lay people, to read and to understand this hard data. But people can really get moved and get action based on the real voice of people coming from participatory method. And also, like for example, the national study in Vietnam on violence against women that we conduct recently. So in addition to the national data statistically, right? So using quantitative method, that's the first time the GSO, the General Statistic Office, they ask all the data collector to write their diary every day. And then the data come out from that beautifully, because this show also the experience of these women when they're collecting this data, when they listen to these stories, and this can really see how important that kind of thing to experience to contribute to a good data when these women collect. So they not only collect this data as their professional, but they also collect this data from their standpoint of view as a woman, a mother. So I think there's a lot of value when we add those methods together. Yeah.
Okay. So maybe we can give the floor to some people, or I can pick up a few more questions. One of the questions that I think is also possibly relevant to both pieces of research is the ethical review process, which it can be really like a tick box exercise. It can even be very exploitative mechanisms where you have ethical review boards in countries that charge funding based on the size of the budget of the proposed research. And I don't think the size of participatory research is large enough to generate that kind of interest, but who knows? And then you also have this need of being flexible. So after you've gotten your ERB approval, there is, as you both say, this need to be flexible, and there is really a need for the participants to give a real consent in this changing situation. What ideas do you have to have an ethical, maybe more bottom-up approach with every single meeting having to go to a whole formal ethical review, community-led or not? Like, can you share some of your experiences?
Sure. So I think I actually did respond to one of the questions that was about the ethical review processes. But I think in this particular instance, we started this work in 2015. And at the time, I think having community-led ethical review processes was something that was quite new for us as well. We figured that since communities who had the lived experience of forced labor had been part of every single one of the steps in our research design, it didn't necessarily need to then be further vetted by others who may have had the same experience. So whether it was the stories that they shared about their lives, which formed the basis for the questions that actually went into the statistical tool, or became the basis for the action research itself, it was all, it was all kind of informed by people with this lived experience. They then, so the organizations that worked with these individuals, as well as a lot of individuals who had that experience, were part of a lot of the analysis and design workshops, both for the participatory statistics tool as well. And they were all involved with the data collection as well. Subsequent to this engagement, if we ever find that there are surveys or instruments that have been designed by researchers, academics, or NGO practitioners who may not necessarily have had the lived experience of the theme that we're collecting that information on, we do facilitate community-led ethical review processes, which are processes where community members with that specific lived experience. So let's say in Tuan's case, where we've done a lot of work with people who have been susceptible to HIV, we have had different categories of people. So different men who have had sex with men, injecting drug users and so on, inform and tell us how research processes should be carried out, talk about specific sets of questions, and also then kind of be peer review us all along. So when initial information comes in, they review and help us analyze this data and tell us if we're missing any lenses in these processes. So of course, I'm not saying that every community-led ethical review process necessarily is perfect. There will always be some sort of bottlenecks with some of these, but I think the idea is if there is a true intention to involve community members and make sure that they actually lead some of these, we do end up, having a lot of these processes. And another thing that we very actively push for is ensuring that we have community representatives co-author pieces of writing with us, which are about their own lived experience. And it's not just about me as an NGO worker or me as an academic, who necessarily, always authors all of these articles. So I think that's what we try and attempt to do. And I can just put in a few links of how some of these ethical review processes have worked and what some of the big challenges have been in the chat box.
Okay, thank you. I am quite sorry, but we have reached the end of the hour. I'm so sorry. I would first like to thank the presenters for their wonderful presentations and the work they've done and been able to share with us. Thank you for everyone who has attended. If you would like to know more, you can contact us at IDS, and we can then link you directly to Sonia, Anusha, and Tuan. Or if you can find a way to contact them directly. It was really a pleasure having you all here, and I hope this has inspired you. There's a lot more information and detail in the handbook itself, also from other people who've used mixed methods, and you'll see how you can combine them in a creative way, if you like to answer your questions that you have or that people in communities that you work with may have. So thank you all very much, and who knows where we meet again, maybe in reality, in person. Thank you.
Thank you. Thank you very much.
Thanks a lot.
Yeah.
Thank